right, we are now live.
Hey, welcome back, everyone. We're doing another question and answer session where we moved our session into the photo room, so if our background's a little different, that's why. So let's get started.
All right. I have Motorhead Dover asking, will you operate on someone out of the country?
Yeah, about 40% of our patients are out of state or out of the country. I don't know the exact breakdown of how many of our patients are out of the country, but I would say maybe about 10%. 10% of our patients are probably out of the country. Canada, obviously, being the highest proportion, but we get Europe, including like UK. We've got Middle East, New Zealand, Australia, Israel. So all over the place.
Pink Lemonade would like to know, can I regain my stomach after I get a tummy tuck?
Well, theoretically, there are still fat cells left. So let's say we do a tummy tuck and we remove skin, and we also remove fat cells, and then we repair muscle. So if, for example, you get pregnant and then you gain a bunch of weight, then theoretically you can stretch out your muscles, and then you can also increase the size of the fat cells. But we've had a couple of patients that have gotten pregnant after a tummy tuck, and it's remarkable how well the tummy tuck holds up. In the long run, you can always expand the abdomen, so you can regain weight in your abdomen if you gain a lot of weight. It'll be proportionally less because there'll be fewer fat cells there, but you can still, there are still fat cells left. Excuse me, so you can still gain weight.
Karina Ramirez would like to know, do you have any BMI restrictions?
We don't. Sorry, just swallowed something. So we don't have a BMI, or we don't have a weight restriction. We've done BMIs as high as I think maybe 54 or 56, and then we have a patient coming up that's like close to 70 BMI. So we'll see if we can modify how we do our procedures, and we'll see what kind of results we get in terms of safety and efficacy. But we've never had death, and we've never had a emergency transfer and things of that nature. So, over the last 15 years, we've been doing all these plus-size tummy tucks with BMIs as high as 54, 56, maybe something like that. And we've been successful so far in getting great results, but also in doing so safely.
Cry Sanders would like to know, I need to have ACL reconstruction surgery. How long after a plus-size tummy tuck can I have that surgery?
Well, from my standpoint, it doesn't make that much of a difference. Obviously, if you have ACL surgery, they might put you in one of those mobility things where, they move your knee around. Your mobility might be impacted a little bit. So I would wait probably at least 3 months, probably a minimum of 3 months, longer probably better, between tummy tuck and ACL. And the reason for that is we want your body to be fully healed from your tummy tuck before you sustain other type of maybe limitations. And we're worried about primarily blood clots, right? So we want you to be fully up and running after a tummy tuck to really get any kind of knee surgery, just so that you don't get dehydrated, and then mobility kind of gets reduced again. So I would say at least 3 months.
Diana Panda would like to know, would you operate on someone who had a gastric sleeve?
A lot of our patients have gastric sleeve, gastric bypass, lap band surgery. Our tummy tuck from today had a lap band surgery. So we do it all the time.
And about how long after that operation do they need to wait until they can get that procedure?
Well, it all depends on how you're losing your weight, right? Because if you're in that moment after your bariatric surgery where you're losing weight consistently, I would wait until you plateau off a little bit in terms of the rate of weight that you lose. Because if you're losing weight pretty fast, then you're kind of hitting a moving target. So I'd probably wait until you kind of flatten out that curve in terms of weight loss.
Bam123 would like to know, do you operate on people with diabetes?
We do, both diabetes type 1 and type 2. You'll want to have your diabetes controlled as opposed to uncontrolled, because surgery tends to spike your blood glucose levels. So if your diabetes is not well controlled, it'll spike even higher in the operating room and even in the post-operative recovery phase. So diabetes by itself, not a problem if it's controlled.
Jenny90 would like to know, are the massages very necessary after the surgery?
You're referring to lymphatic massages. I don't have a protocol for that, meaning I don't require them. I don't like necessarily prohibit them either. For procedures such as tummy tucks, where there's a lot of dissection involved, I usually recommend not getting any lymphatic massages for about 2 months for a lot of different reasons. Now, obviously, other doctors have different ways of doing it, so there's some variability in that. But I would say the way I do my tummy tucks, I would not get a lymphatic massage of your tummy tuck area for at least 2 months.
Sylvia, 1803, would like to know, what are the risks during a tummy tuck procedure?
Well, all surgeries have obviously bleeding, infection, anesthesia-related complications as their kind of standard, right? Because that's always a possibility regardless of what kind of surgery that you have. Those are all very small, like, anesthesia-related complications, virtually unheard of. I don't think we've ever had any in the last 15 years. Bleeding, obviously, if you look at our videos, very little bleeding happens. We control all that stuff. Infections can happen, also very rare. So I think the more poignant part of your question is what are the common complications that can happen with the tummy tuck, for example, right? So the most important one that we want to try to avoid is blood clots, DVT, PE. We've had, I think, 5 or 6 over the last 15 years. They've all been pretty mild, and they've all been at 4 to 6 weeks out. Pretty interesting. So I think that pretty much indicates to us that our protocol is working for DVT prophylaxis, meaning prevention, or reduction in the risk. So I think at 4 to 6 weeks out, patients tend to kind of maybe get a little bit more complacent and kind of deviate off that protocol. So I think the most severe one that we want to avoid is DVT, PE. The more common ones are probably like, drain-related issues or a little blistering and things of that nature. So overall, we've been pretty fortunate. Not a lot of major complications.
Rose House Talks would like to know, is it possible to do a thigh lift and a fat transfer to the buttock at the same time?
You can. We've done that before. You can do a lot of different things. As long as you're healthy and there are a good combination of procedures, you can certainly do it. So yeah, thigh lift and fat transfer to the buttock area totally can be done as long as you're otherwise in good health.
Stassi would like to know, I plan on having a baby close to 6 months. After my procedure, should I wait longer to have that operation?
It's up to you. I mean, the next question is, so I guess the question is, what kind of operation are you having, right? If you're having a tummy tuck, the next question is, are you able, or is it better to have a baby and then have a tummy tuck, right? That's probably a little better way to do it. But there's no harm in getting a tummy tuck and then getting pregnant afterwards. It does undo maybe some, maybe like 5, 10, 15% of the tummy tuck result, because obviously there's a baby growing in there. So maybe the scar widens a little bit, maybe there's just a little bit of loosening of the skin. So in the ideal world, it's pregnancy, delivery, then tummy tuck, right? But there's no harm in doing tummy tuck, then pregnancy. It won't harm the baby and it won't harm you either.
MMA Torres would like to know, my cousin and I would both like to have a plus-size tummy tuck. Could you do 2 in the same day?
Yeah, you can. And we've done it. So absolutely.
Spanish Mommy would like to know, can I have surgery with previous PE history?
Well, we have to dive in to figure out what the PE was caused by, and if your hematologist clears you for that, right? So for example, if you've had a PE and you're no longer on any blood thinners because that was a one-time event associated with a specific component of your life, I don't know, let's say you were immobile from a hip fracture or something like that, then you're probably at average risk for a PE. However, if your genetics are predisposing you to a PE, then your hematologist will want to give us some guidelines on what type of blood thinners he or she would want you on. But the short answer is yes, you can still have surgery.
Lorena Glam 4 would like to know, how do you prevent blood clots post-operation?
We have a huge protocol of how to do that. We do put people on blood thinners, but I don't even think the blood thinners are the main component. I think all the other things that we do in terms of positioning, mobility, hydration, squeezers on your legs in the operating room, all of our protocol right before surgery, during surgery, and after surgery, including the blood thinners, are what has helped us in the last 15 years.
Hannah_Eliza would like to know, if you had to travel from New Zealand for a tummy tuck and breast lift, how long would you have to stay in Arizona?
Well, regardless of whether you're traveling from California or from New Zealand, I would probably stay at a minimum of 2 weeks. And that flight back home is a long flight, but obviously you're going to get up every half an hour to an hour, use the bathroom, all that stuff. But when I've flown long distance, even short distances, I'm pretty tired by that. I think just traveling in general makes you kind of tired. So you have to imagine how you would feel, after a big surgery. So I would stay a minimum of 2 weeks, probably 3 would be a little better. Excuse me, my sneeze.
Bless you.
Thank you.
Free-range browers would like to know, do patients lose nipple sensitivity after getting a lift and an augmentation?
The lift is very rare to get nipple sensitivity loss, unless it's done in a certain wrong way. So usually breast lift by itself, nipple sensitivity, no problem. Breast augmentation, also pretty rare, but if you get a big implant in there, sometimes that encroaches on kind of where some of the nerves are for the nipple, and so you might get some sensitivity issues with that.
Lee Pumpkin 20 would like to know, when getting a plus-size tummy tuck, do you lipo the flanks as well?
I include that. Yeah, I include liposuction in the abdomen and flanks and in the pubic area with my plus-size tummy tucks.
K Cakes 365 would like to know, I'm traveling from out of state. Do you have a recovery home for a mommy makeover?
Yeah, we try to do the best that we can for all service-related things. So we have a board-certified anesthesiologist, a private surgery center. We have a private overnight suite right in the same building. I see all my patients for pre-op, for post-op. I do the whole surgery, basically from start to finish. So we try to kind of encompass everything that we could possibly do to have the greatest success.
Bori Galaga 23 would like to know, how does having metabolic syndrome affect the patient during and after the operation?
I guess it all depends on what kind of metabolic syndrome you have and how severe it is and how it's controlled. All medical problems are fine if they're controlled, right? So if you have a controlled medical problem, you don't really have a problem. So I'm not sure how to answer that. I have to look at specifics of how your metabolic syndrome is affecting you, how it's managed as well. Obviously, if your electrolytes going into surgery are normal, the only thing I can think of is we may want to check your electrolytes after surgery at one time and just to make sure, but otherwise you should be fine.
Chun Z would like to know, can a plus-size tummy tuck be performed after having 3 C-sections?
Yeah, the C-sections don't impact the tummy tuck process regardless of what kind of tummy tuck you do. We usually put our incisions below the C-section scar, so we end up removing the C-section scar at the same time.
Jordan Keller Matthews would like to know, what are your thoughts on hyperbaric for surgical wound healing?
You know what, the literature, there's a couple of articles that show that it might be helpful, and there's a couple of articles that show that it may not make that much of a difference. So I think that obviously the body, it depends on where the wound is and what kind of wound you have. But if your wound is clean, meaning it's been debrided, it's not infected, there's no necrotic tissue, and if you have a good dressing on there, so wound vac is a pretty good dressing for a big wound, then the hyperbaric is kind of like the cherry on top possibly, but all the other ones are more important. So the hydration, proper nutrition, debridement, clean wound vac, those are, I think, the more important parts compared to hyperbaric treatment. But if you have all that stuff, then the hyperbaric is basically, like I said, it's like the cherry on top. It might help, but it won't hurt.
Mike Can't Stop Won't Stop would like to know, do you have experience with male clients for best results? I've noticed most of your patients are females.
Yeah, most of our patients are female, but we've done some pretty substantial male surgeries, and some of them were pretty, famous. And so if you look at our before and after gallery or on Instagram, but if you just even go to YouTube, we've done quite a bit with chest and back and abdomen and some thighs and stuff. So our experience with that is more than ample. So obviously, there's some similarity between male and female surgery, but there's also some differences. And the waist, women want a narrower waist, but guys want a more square waist. And then the incisions for the chest, obviously guys don't wear bras, so you have to be a little bit better about putting the incisions kind of armpit and then following the pec border and things of that nature. So given the fact that most plastic surgery patients are women. We actually have quite a bit of experience with male surgery.
Mm-hmm. Star-studded caterer would like to know, is it okay to stand up straight after a week post-tummy tuck?
Well, it depends on what kind of tummy tuck you did and how much tissue was removed, right? So that's going to be a decision for your doctor to recommend you to. I'm not a big fan of over resecting tummy tucks because that seems to be a little bit unnatural. So you should be able to be fairly straight within that first week. I don't recommend being hyperextended, but you should be able to be fairly straight. Being hunched over is going to really hurt your back, and if you have to be hunched over, that's probably, it might indicate maybe too much skin was removed.
Allison Marie 3 would like to know, would you recommend doing a thigh lift at the same time as a plus-size tummy tuck?
You can. It all depends on what kind of thigh lift. I'm not a big fan of the thigh lift tummy tuck combo because I want to compress the thighs properly and I want to compress the abdomen properly. And sometimes garments don't fit great both situations. Second is some people really benefit from having a thigh lift incision that has a little bit of a horizontal, almost like a groin crease, regardless if they have a vertical one as well. You have to remember our tummy tuck incision is super low and down the groin as well, so those two incisions can be very close. So for those two reasons, I'm not a big fan of doing them together, but you can.
Elizabeth O would like to know, do you sell any scar gel for after surgery or do you have any professional recommendations?
Well, the key to a good scar is really the surgery, because you can't control your genetics, right? But the surgery, in terms of good tension, not too much, good manipulation of tissues, good sutures, clean surgery, not a lot of inflammation, that's by far the most important. Embrace scar therapy does seem to have the best data for scars. Not 100% necessary if you have a good kind of surgical component. And it's really only relevant in people that have like kind of okay surgical component. If you have bad surgical component, like a lot of tension and stuff, there's nothing that will ever help that. That scar's gonna, if you have way too much tension, that scar's gonna widen no matter what.
And then following that question, Terry would like to know if higher pigmented patients scar worse than lighter pigmented patients.
Not necessarily, yeah. I mean, there's a tendency if you put a lot of tension on a incision to get a ropier or a darker scar or darker skin individuals. And certain people have a little bit higher tendencies, so like African American, Asian American, something like that. But the key is how you manage that tissue. So all in all, the key to a good scar is the surgical part, because you can't control genetics.
Chandra Wink 75 would like to know, isn't anesthesia riskier for high BMI patients?
That's not been our experience. So we've never had a death. We've never had anesthesia-related complications in 15 years. I think that if you really look at the fine details, you can say, well, everything is potentially riskier for high BMI patients, but only if it's done the same as you would do for like a regular BMI patient. So you have to change how you do things. So you have to have a good anesthesiologist, and fortunately we do.
Nancy A013 would like to know, what are the rules post plus-size tummy tuck, specifically in regards to returning to work?
Well, as a ballpark, everyone's a little different. Usually, first 2 weeks, focus 100% on your recovery, don't do anything else. Second 2 weeks, more of the same unless you really have to do certain things. So obviously, if you have to go to work, then you have to go to work. But if you don't, then taking a little more time off is even better. No working out for 6 to 8 weeks.
Jen Fawcett would like to know, how soon after having a baby can a mommy makeover be done?
Well, there's no restriction from my point. I think the ideal situation is you want your body to kind of change as much as it can on its own, right? So instead of having the baby and then operating on that, you want the body to kind of do its own shrinking up process and going back to how it used to be pre-pregnancy. And then do the tummy tuck or mommy makeover at that point.
Jazz SCUEN. Breast reduction and lift can I still breastfeed? Recommended to do before or after having kids?
Well, the second part of the question is, obviously it's always better to do it after you have kids if you're planning on having kids anytime soon, right? That makes all the sense in the world because, you can have your kids and then you can just rejuvenate your breast with a breast augmentation or breast lift and you're done. However, if you're potentially having your kids down the road, year 2, 10, then you're not going to wait that long. So yes, you can certainly do surgery and then have kids afterwards. You should be able to breastfeed with breast augmentation and with breast lift.
Shelly Carr, one would like to know, is a plus-size tummy tuck more dangerous than a normal one?
Well, if you do the plus-size tummy tuck the same way that you do a regular tummy tuck, then theoretically, yes. Because those are two different physiologic and anatomic requirements, right? So the person that has this much fat underneath their skin versus the person that has this much fat, the physiology of that anatomy difference is different. So you have to treat it differently, do things differently. But the reality is we have not had any deaths, we've not had any emergency transfers to the hospital. So, in terms of the important safety features, they've really been the same.
Francesca 4 would like to know, how long after a tummy tuck will I have to wear compressions or garments?
I would recommend at least 6 to 8 weeks. A little bit longer, sometimes even better.
Simone T would like to know, at what age does skin lose its laxivity?
That's totally variable. Some people are quite young, some people are, they never lose it. So I've seen 70-year-olds with amazing skin. It's just, it's like it barely hasn't aged a bit. Then I've seen 30-year-olds where the skin has really lost a lot of elasticity. So some of that's genetics, you can't control that. Some of it is environmental, weight loss, weight gain, pregnancy, right? Things that we can control. And then some of it is, in addition to that, things that we can control that are like maybe personal stuff, like smoking, a lot of sun exposure, poor nutrition, poor health, that kind of stuff.
Kenny M12 would like to know, what is your input on diet culture?
I don't know what that question really implies. If diet culture is a specific thing, I don't know anything about it. If the general question is like, what do you think about diets? I think our definition of diet is too specific. The biggest component about nutrition for me is the closer to real food that we eat, the better we're going to do. So you have to imagine that our bodies have really been designed to eat real food for a long time, and it's only been in the recent 50, 60 years that we've started doing processed foods, canned boxes and stuff like that. And so when we do that, we have a man-made interaction with nutrition. And there's always unintended consequences to man-made actions, right? So I'm a big fan of eating as close as you can to real food as possible.
Brandy S would like to know, what is considered a plus size?
Well, everyone defines that a little differently. Most people say 35, BMI 35 and higher is plus size. Some people do 30, some people do 40. And then if you think about it, some people may not have a high, BMI is only two numbers, right? Height and weight. But maybe someone has a lot of body mass, a lot of muscle. And so maybe they have a BMI of 35 or 40, but they're otherwise, like their subcutaneous fat is actually pretty good and they're pretty healthy. Conversely, someone might have a BMI of 30, but they have so little muscle mass that they're really they're closer to like a BMI of 35 or 40. So it's a slippery slope, and you really have to look at each individual a little bit differently. So I don't really care about BMI too much because it doesn't really give me good, consistent data about the safety and efficacy of what I can do for that patient.
Julia A. Lee would like to know, why do other plastic surgeons have a BMI limit but you don't?
Well, two main reasons, but there's probably a lot of smaller reasons, but two main reasons. One is you can't do the same for a regular, quote-unquote, regular BMI patient versus a high BMI patient. You can't do the same procedure. You have to modify it. And it takes a while to learn how to modify it, so you can't just decide to do it. You have to slowly do that process. And so you have to commit to that journey to learn and do things better and better. So that's the one reason. The other reason is higher BMI patients, like traditionally defined, are a lot more work physically for the surgeon and more challenging conceptually, geometrically. And then so some plastic surgeons just don't want to really take on that extra difficulty, right? And those are the two main reasons. And so, we've just slowly, incrementally changed how we do things over the last 15 years. So for us, doing a BMI of like 45 or 50 is almost routine. We basically do one every single week. But that's taken 15 years to get there.
Alex Martini would like to know, I know a backlift is done in the middle of the back for people, but can it be done on the bottom for people who have a top back tattoo?
Well, it all depends on where the loose skin is, right? So, and it all depends on where the loose skin used to be. So a bra line backlift, which we published in 2008, is an incision wherever the bra strap is at. That's a good place to hide it. It's designed to pull the lower skin below that higher up. So it helps with the waist contour, helps with the side breast, back fat, bra rolls. If you have a lot of loose skin or a tattoo right above your buttock area, that's not going to help that. If you do an incision in the lower bikini area where your buttock area is, that's designed to really remove skin in the buttock area to the lower back area. It has nothing to do with the middle back or higher upper back.
Love Angel would like to know, will an extended butt lift reduce sagging butt skin?
Well, you know, the buttock area is like the breast area, so you have to think about both volume but also skin laxity. And sometimes you have to use both. So if you have both problems, a volume issue and a skin laxity issue, and if you only use skin laxity treatment, basically an excision, like extended buttock lift, you're going to flatten the buttock area because you're going to take out too much skin. Conversely, if you only use the volume issue like buttock fat transfer, you're going to make the buttock area way too big because you're going to really plump it up so much to get that skin to be taut. So you have to define what the problem is and then what percentage of each problem, and you got to treat it accordingly.
Elena Caesar would like to know, can you choose where the fat is taken from when getting a BBL?
Yeah, 100%, your choice.
Ethereal Lady would like to know, can I get surgery if I am 62 years old? I want lipo 360.
There's no reason not to. I mean, we've had patients that were, I think they've done a tummy tuck on a 78-year-old or something like that, 76, 78-year-old. So age is not an issue. It doesn't really say anything about your health or physiology, so there shouldn't be any issue.
Jay Benjamin would like to know, do you do facial procedures as well or only body?
We do a lot of body. You know, it's interesting. 5 years ago, I was about half face, half body, and then over the last 5 years, you know, there's just so much demand for the body stuff that we do, some of the challenging cases that we just get a ton more inquiries and a ton more consults and a ton more surgeries. But we do, so like last week we did, one day was all face and then the other days were like breast and body. So I would say maybe about a third of my practice is face.
Maritzia714 would like to know, how long should I wait to get a tummy tuck after a hysterectomy that was performed laparoscopically?
Well, I would say pretty much at any point, as soon as you feel like you're back to normal, right? So if you're in pain, then I would say wait longer, because there's no point being in more pain. If you're feeling fatigued because you're healing, then wait longer. So as long as your energy is back up and your pain's back down, should we go?
Jay Salon E. Stanley would like to know, do you do drainless tummy tucks?
You can. I'm a big fan of drains regardless of what we do in there. So when you do a drainless tummy tuck, you have to put quilting sutures, basically sutures underneath. And we do that anyways, but I still like to put a drain in there. And the reason for that is, even when we do that and we put a drain in there, there's still quite a bit of fluid that comes out. And if you don't evacuate that fluid, your body will form scar tissue associated with it. And the only way to remove that scar tissue is to redo the whole tummy tuck.
Opulent Cakes would like to know, do you do thigh lifts on patients with varicose veins?
Yeah, our patient yesterday had a thigh lift amongst other procedures, and they had varicose veins as well. And I run across them. We just ligate them and cauterize them and then keep moving.
Ensley18 would like to know, is it better to lose weight before the tummy tuck procedure?
Well, in the ideal world, then if you lose all the weight that you need to lose, then you know you're just getting a regular tummy tuck, which is totally fine. But some people don't want that and maybe choose not to or can't, right? So then you can choose to do whatever you want. I would just decide how much weight you want to lose and by what time. So I think probably the best thing to do is just pick a date and say, like, I'm going to have a tummy tuck 6 months from now. And then I'm going to live a good lifestyle, and then wherever I am at that point, that's when my tummy tuck is. As opposed to do like a crash diet, lose a bunch of weight, and then have a tummy tuck, because then you're going to bounce back afterwards. So back to that nutrition question a few questions ago about just, you know, live a lifestyle that you can continue for the rest of your life. So as much real food as possible.
Anhi_10 would like to know, can a person with lupus get a BBL or tummy tuck?
Yeah, 2 weeks ago, I think 2 weeks ago, we had a person with lupus, and quite a bit of it too, right around the tummy tuck incision, and we did just fine.
Mariana would like to know, can you do a rhinoplasty and a tummy tuck in the same procedure?
You can, there's no problem with that.
And then Full Size Pink would like to know, what is the amount of skin removed during a tummy tuck that can be done properly?
Yeah, it all depends on the geometry. So we've taken out 40 plus pounds in some of our big plus size tummy tucks. But we never try to remove a certain weight of tissue. We just always look at contour and of course safety. So we just try to get the best contour with the best safety possible. And then whatever that tissue is whatever that tissue is.
Rachel Williams, 85, would like to know, can you have a tummy tuck and chin liposuction at the same time?
You can, no problem.
And how much is the most amount of fat you can lipo out during a procedure?
Well, you have to imagine, 6 foot tall person versus a 5 foot tall person, different amounts, right? You have to imagine a 6 foot tall 30-year-old versus a 5 foot tall 60-year-old might be a little bit different volumes, right? Because with age we lose a little bit of our resiliency. And then, the one person maybe has a couple of medical problems and the other person doesn't. So it varies. There shouldn't be almost any problem with 5 liters removal, but we've gone up to like 10, 12. A long time ago, this must have been like maybe 10 years ago, they did 17 liters on one person, but they were taller and they were younger and they were healthier. They did just fine.
Vienna 831 would like to know, what is the highest BMI that you've ever worked on, and what is the highest you'll go?
I don't have a BMI requirement, so as long as I can do things safely and get a great result, I'm going to do it. A high is probably 54, 56, I can't remember. We're gearing up to do someone that's close to 70, so I'm working on thinking through all the things that I need to do before, during, and after surgery to modify that might be helpful for that person.
All right, and then finishing off, do we offer financing?
We do. We work with Care Credit, Patient Fi, and Alphion for third-party financing.
And how can people go about booking a consultation with you?
Well, a lot of different ways. Most common is just go to the website, do the virtual consultation button or schedule a consultation button at the top. So that's Dr.Repta.com. But you can also call us. Our phone number is 855-377-3782. And then, of course, Instagram, you can always message us there on some of the other social media components.
Perfect. And then about how far out are our consultations booking at the moment?
Actually, I don't know. I know surgeries are booked at about 2.5 or 3 months-ish. That's kind of where we, plus or minus a month. I would imagine consults are about 2 weeks or 3 weeks out.
Virtuals are about 3 to 4, and then in-office are about 4 to 5 at the moment.
Okay, so a month for consults, 3 for surgery.
Perfect. Well, thank you very much, Dr. Repta.
Thanks, guys.